I'm Rink Murray. I'm one of the partners here at Tennessee Reproductive Medicine, and I'm here today to talk to you about natural cycle IVF, mini IVF, and how those compare to standard IVF performed here and at most clinics. Let's start with standard IVF. Standard IVF is where a woman takes a high dose of medication to get a maximal number of eggs to be produced by her ovary. We retrieve those eggs, fertilize them, and in general, that maximizes the number of embryos we have available for transfer. So she has the most opportunities to get pregnant. By contrast, minimal stimulation IVF, we give a smaller dose of medication. She gets a smaller number of eggs. She has a smaller number of embryos, so she has fewer opportunities to get pregnant. Natural cycle IVF, we typically let the woman ovulate on her own, so we're going after one egg. Well, that is a lot like walking on a high wire. Any misstep, you could fail to get pregnant. It has the lowest chance of pregnancy, but it also is the lowest cost. On average, I would say a standard IVF cycle is about $15,000 with medications. Minimal stimulation IVF is going to be $7,000 to $8,000 depending on the amount of medication somebody requires. And a natural cycle IVF cycle is going to be roughly $6,000 with medication. Now, if a woman only has 2 or 3 eggs on her ovaries, it makes absolutely no sense to put her through a standard IVF cycle because we're not going to get 10 or 15 eggs. She's going to do just as well, maybe even better with a minimal stimulation IVF because we give her a small amount of drug, she ovulates maybe 2 or 3 eggs, but now she can do that twice for the same amount of money she would have spent to do one cycle at standard IVF. Dr. Scotch and I decided to start doing natural cycle IVF and mini IVF primarily in response to patient needs. Just to help people understand a couple of scenarios where people might want to consider either minimal stimulation or natural cycle IVF. We've had people who had medical conditions where they really couldn't take medications. It would be too dangerous for them to take the medications. So we've gone with natural cycle IVF for them. So there may be a medical reason that somebody has. There can be situations where people just can't afford the other medications and they're willing to compromise some success rate to have a chance for getting pregnant. And that chance may be as high as 40 or 50% with minimal stimulation, depending on the patient characteristics. The bottom line is, this is going to be an individual decision between the doctor and the patient to see who's appropriate for which treatment.